Hi, you guys probably know me. My name is Robert Pierce, but you can call me Bob. Most people do. I'm a medical assistant at Kauai Medical Clinic along with Myra. And I went through this program just like most of you are now. Good program. I go to school at night also, so I know how valuable your time is, and I really appreciate you sharing it with me as my audience, as I need my audience in order to pass this class. I hope tonight to inform you and enlighten you. My topic is one of concern to just about every family in America to some capacity or other. I even have some cutting edge information that my interviewee, Dr. Trawler at the Kauai Medical Clinic, just learned about in a conference that he went to, which he called the Movers and Shakers of the Nation last weekend. This was a speech that I had to do that was based upon not only research, but doing an informative interview with a person, and I chose Dr. Trawler because my subject is the diabetes epidemic, including causes and recommendations. And in my opinion, Dr. Trawler is an expert at Kauai Medical Clinic on diabetes. Usually when the word epidemic is used, at least a small amount of fear is enticed into the public eye, or even great fear like it was in the influenza of 1918, where people were dying daily. Every family had somebody that died in their family, and they knew that it was a serious, serious epidemic. Well, people are dying now, but they're dying from complications of diabetes, and the actual death is labeled by another cause, heart attack, stroke. So there's a kind of a disconnect there, and we don't have that ideal of the epidemic and that fear of it, but it exists. It can be traced back to diabetes when you're diabetic. Even though it's a heart attack, even though it's a stroke, if you're a diabetic, it leads back to it through the conditions that have been happening. As I said before, my information-getting interviewee was Dr. Donald Trawler. He's the director of Health Management Department at Kauai Medical Clinic. And he really put some thought into my questions, and I really appreciated it. And I had to do a Reader's Digest version of his answers to fit the information into this speech. In his opinion, the main reason we are having this epidemic is based upon the American lifestyle. Lack of physical activity, foods high in the glycemic index that have good flavor and entice us to eat it. Preventing obesity is an important objective to fight diabetic epidemic. Obesity rates are plateauing among Caucasians, rising rapidly among Latinos, African Americans, and Asians. But informing the public is starting to have a good effect. When a person first learns that they have diabetes, they're scared. It's kind of a shock. They go, I've got a disease now. So there's a window of opportunity for the physician to take advantage of that learning opportunity they have. And most of the time, the patients become compliant with the treatment that the physician outlines for them, which is really a good thing. But like with anything, patients become complacent and the results are good, so they get used to it, and the holidays come along, and then pretty soon they're going off the wagon, and their A1Cs go up, and they have a New Year's resolution after the holidays are done, and the A1Cs go back down again, and everything's good. And it's a cycle of compliance and uncompliance. It happens that way all over the United States for one reason or another. And one special season here in Hawaii is mango season. A1Cs go up when mango season happens, go back down after mango season is over. Diabetes is a vascular disease. No one has ever died from high blood sugar, but they have died from what high blood sugar does to their blood vessels. High blood sugar causes glycosylation, I never say that right, of the blood vessels. What he said, it was kind of like a fermentation of them. And it's a chronic inflammatory process. It occurs in large and small blood vessels, but small blood vessels are much more fragile. And the first complications will be retinal because there's very small blood vessels in the eyes. And they will also start appearing in the kidneys because there's also very small blood vessels in the kidneys. This is called microvascular complications. Fortunately, regular eye exams help with the retinal microvascular complications. A lot of big words here that I'm stumbling on. Other complications like obesity, high blood pressure, and dyslipidemia are all part of the package. And although serious and painful, neuropathy and diabetic foot ulcers aren't the worst complications. The worst are the fatal complications like heart attacks and strokes. And if you live long enough, kidney failure. But most people that aren't compliant die from strokes and heart attacks before they get to the kidney failure. It's not a pretty picture that I'm painting. Genetics play a huge role in whether you develop complications. There's a very small percentage of people that can have really high blood sugar for most of their life and they get absolutely no complications, but the majority do. So if you're diagnosed with diabetes and a person controls their blood sugar, their complications will also be controlled and they can possibly live a long life, a long normal life, 80s, 90s. Okay, got some pictures here. Other things can also damage blood vessels. Smoking, high fatty foods causing hyperlipidemia, high blood pressure for the hypertension, and they create what's called a triple target. If you can get good glycemic control, good lipid control, and good blood pressure control, and accomplish those three targets, you greatly reduce the risk of having any complications from diabetes. Exercise helps greatly. These are the various treatments that diabetics get: insulin, medication, test your blood sugar, have regular heart checks. All of these tests help to monitor how your diabetes is going and for your physician to decide what treatments that you need to have continually happen. And this is Mandy and this is Randy, and they are genius scientists helping develop things for the future. One of the things that I will talk about that I said was cutting edge. You can move back out again, please. What Dr. Trawler does basically is he provides information at the patient or layperson level for them to use in their daily life. He also does coaching, which basically boils down to motivational speaking, and it provides step-by-step lifestyle changes. Unfortunately, one of the main lifestyle changes is to stop drinking soda, one of my personal difficult ones. Soda, whether it's diet or regular, stimulates the tongue over and over and over again, creating a hormonal response. It's not the sugar that creates the problem for diabetes. It's this hormonal response. And Diet soda has been linked to obesity, heart failure, and diabetes. He talks with them on how they can quit and learn to drink just water. He's really big on that. He's sports drinks, Splenda-based drinks, doesn't matter. They're all too stimulating on the tongue and will release these hormones that creates the problems for diabetics. Diabetes, as I said, is a hormonal disorder which affects behavior and cravings. Potato chips, candy is a whole bit. I brought candy, that's real smart of me. With training and repetition, the behavior and cravings can be changed. In the past, we had a real small tool chest of medications to help us deal with diabetes. There have been radical new drugs that help greatly in the last 5 years alone. In the past, most diabetic type 2s ended up having to use insulin. Now, that's been reduced greatly, and very few type 2 diabetics are going to have to lead to insulin to control their diabetes and their blood sugar. Dr. Trawler thinks that with a strong commitment at the public health level, they can stem the tide of the diabetic epidemic and a strong policy effort. Part of that effort is to mandate physical education back into the schools and provide regular physical activity for children. Also to have special classes for at-risk children that are already showing signs of diabetes. He thinks that all children should be taught at an early age about the health risks of soda and fast food and the health benefits of physical activity. A physician works hard to establish a good drug regimen for his diabetic patients. Each individual patient reacts differently to the different types of drugs that are available. And through lab result testing, the doctor can determine which ones are good. And it makes it really difficult because then every year insurance companies change their formularies and say, oh, we're not covering this drug this year, now there's these that are available. And they do that because there's competitive bidding and they're getting this one cheaper now, so they don't want to pay the money for the one that they were getting last year. Don't agree with it at all, but I'm not really going to go there. They do provide evidence-based drugs to a great extent, to an affordable extent. One of these drugs is a generic drug that Dr. Trawler thinks is wonderful. It's effective, it's cost-effective, it works with other drugs greatly, and that's metformin. He prescribes it to all of his patients, regardless of what other medications he's using. He also thinks that, because there's been tossed around that maybe insurance companies would start penalizing patients when they're non-compliant. He doesn't think that's a good idea at all. But he does think that giving incentives for people who keep their A1C down or hit their triple target should be given, like lower copays or some form of reward that they can recognize that will help them be motivated towards doing good compliance. Many consider a cure is possible. Now here's where it gets weird. Oddly enough, people who get bypass surgery, not banding, cupping, or sleeving, but where they actually get the surgery where they bypass the stomach, their blood sugar is normalized within days, even before they lose any weight whatsoever. Gut flora study, this is what he learned. He didn't even know it before last weekend. He learned this at the conference. Gut flora studies led to studies where they do fecal implants in rats. Yeah. They flush out a rat, take fecal matter from a skinny rat, and implant it into another rat, and it produces another skinny rat. So, based upon those experiments, they've discovered that by changing the gut flora of a human, they can eliminate diabetes and induce weight loss. Yeah, they're not going to go there with the whole fecal matter thing. That's what they're trying to do is they're conducting experiments to develop synthetic metabolites who will act like the gut flora action needed without bugs or fecal matter. Just, you know, as humans, we like to synthesize things. If a cure is developed, it's going to be developed by the pharmaceutical companies. And there's big money to be made, big money required to develop it, so that's just a fact of life. And here's a side note. Since there were cardiac problems from previous diabetic drugs, they have increased the testing of cardiac mortality in any new diabetic drug that's introduced. And surprisingly, Jardiance and other drugs that are in its class reduce cardiac mortality by 15% compared to the control group. Just the opposite of what those other drugs were doing. 15%, which is an incredible amount of improvement over the control group. And it started out from the very beginning of the testing. It is the first drug that has shown a correlation between controlling blood sugar and improving cardiac morbidity. So that's very promising. There's hope in the fight against the diabetic epidemic. With new medicines and research, the future continually gets better and provides more promise. That's the start of my conclusion. When Dr. Trawler first started specializing in diabetes over 10 years ago, he said it was very depressing. Patients would come to him on several medications and still have an A1C 14, 15. He would start insulin, they'd get fat, do more medications, have more health problems, more insulin, get fatter, more health problems. And it was just a vicious cycle for him, and it really made him unhappy. But the new meds came out, and drugs were starting to be removed from their regimen. Their health started to get better. Less and less type 2s were going to insulin, and their overall health was actually being improved. So it was getting better and work was improving for him, and he sees a lot of hope for the future. And if the government and society work together, we could turn this around. Thank you very much.